Dr. Marjan Assefi asked, "Have you ever considered the complexity of managing a healthcare system? It's like trying to solve a Rubik's Cube that's constantly changing colors." Welcome to the paradox of healthcare management. Let's take a moment to unravel this paradox. At its core, healthcare management is about providing high-quality care to patients. It's about ensuring that the right treatments are available to the right people at the right time. But it's not just about the care itself. It's about the systems and structures that make that care possible. Now here's where things get tricky. Providing high-quality care is not a cheap endeavor. It involves expensive equipment, highly trained staff, and a plethora of resources. And yet healthcare managers are often tasked with keeping costs down. They have to find a way to balance the imperative to provide top-notch care with the necessity to manage resources effectively. And that's not all. Healthcare managers also have to navigate the complex maze of regulations and standards that govern the healthcare sector. They have to ensure that their organizations are not only providing good care, but also complying with all relevant rules and regulations. But wait, there's more. Healthcare managers also have to stay on top of the latest research and advancements in medicine. They need to be aware of new treatments and technologies that could improve patient care, and they need to figure out how to integrate these innovations into their existing systems. Dr. Assefi added, "Let's not forget about the human element. Healthcare management is ultimately about people. It's about ensuring that patients are treated with dignity and respect, that staff are motivated and supported, and that the wider community understands and trusts the healthcare system." So as you can see, healthcare management is a bit of a juggling act. It involves balancing a multitude of factors, each of which is crucial to the overall effectiveness and efficiency of the healthcare system. Indeed, the paradox of healthcare management is a complex puzzle to solve, but not an impossible one. With the right knowledge, skills, and attitudes, we can create healthcare systems that deliver high-quality care while also being efficient, compliant, innovative, and people-centered. What forms the backbone of successful healthcare management? Like the sturdy structure of a building, healthcare management stands on three key pillars: quality care, cost management, and resource allocation. These three elements, when balanced, form a harmonious triad that supports the intricate workings of a healthcare system. First, let's delve into quality care. It's the lifeblood of any healthcare system. Quality care is all about ensuring patients receive the best possible treatment. It involves maintaining high clinical standards, fostering a compassionate environment, and constantly striving for improvement. It's not just about curing diseases or mending injuries, but also about enhancing overall patient well-being. However, quality care alone doesn't cut it. It must be coupled with effective cost management. In an ideal world, healthcare would be free for everyone. But we live in reality, where resources are finite. Cost management is about making the most out of every dollar spent. It involves assessing the value of treatments, reducing waste, and streamlining processes. It's a delicate balance, striving to provide the best care while keeping costs in check. Dr. Assefi mentioned, we come to the third pillar, resource allocation. This is the art and science of distributing resources, be it personnel, equipment, or funds, where they are needed most. It's about ensuring that the right resources are in the right place at the right time. Resource allocation requires careful planning, efficient scheduling, and a deep understanding of a healthcare system's needs. These three pillars, quality care, cost management, and resource allocation, are interdependent. Quality care requires proper resource allocation. Without effective cost management, resources may run dry, and resources, no matter how plentiful, cannot ensure quality care without proper management. In the end, it's a balancing act. Just like a tightrope walker, healthcare managers must navigate the delicate equilibrium between these three pillars. It's not an easy task, but it's essential for creating a healthcare system that works for everyone. The balance between these three pillars determines the effectiveness of a healthcare system. Scene script. How does Mayo Clinic, a world-renowned healthcare institution, manage its operations? Let's dive right into it. Mayo Clinic is not just a healthcare institution. It's a brilliant example of healthcare management done right. A key to this success is their effective management of the three pillars of healthcare: service, quality, and cost. Let's start with service. Mayo Clinic is known for its integrated care model. This means that a team of specialists works together to address a patient's needs. Instead of the patient having to coordinate between various doctors, Mayo Clinic brings the doctors to the patient. This streamlines the patient experience and ensures that all caregivers are on the same page. Next up, Quality. Mayo Clinic doesn't just provide healthcare, it provides top-notch healthcare. This commitment to quality is seen in everything from their state-of-the-art facilities to their cutting-edge research. They never stop pushing the boundaries of what's possible in medicine. And then there's cost. Despite their commitment to top-tier service and quality, Mayo Clinic also prioritizes cost-effectiveness. They strive to deliver high-quality care at a reasonable cost. They're committed to transparency in pricing, and they work with patients to understand and manage their healthcare costs. But how does this all translate to patient outcomes? Quite well, actually. Mayo Clinic's integrated care model leads to more accurate diagnoses, more effective treatments, and improved patient satisfaction. Their commitment to quality means patients receive the best care possible, and their focus on cost-effectiveness means that this care is accessible to more people. In essence, Mayo Clinic's approach to healthcare management is about putting the patient first. They understand that healthcare is more than just treating illness. It's about treating the whole person. This patient-centric approach, along with their commitment to service, quality, and cost, is what makes Mayo Clinic a leader in healthcare management. It's not just about running a hospital, it's about creating a healthcare system that truly serves the needs of its patients. Mayo Clinic's success is a testament to effective healthcare management. What can we learn from the management of the National Health Service in the United Kingdom? The National Health Service, or NHS, is one of the world's largest publicly funded health services. It offers an interesting case study in managing a national healthcare system, particularly in terms of resource allocation and cost management. The NHS faces a multitude of challenges, many of which are shared by healthcare systems around the world. These include an aging population, increasing demand for services, and the rising costs of healthcare technology. However, the NHS has also seen significant success in its 75 years of existence. One of the key strengths of the NHS is its commitment to universal healthcare. This principle, enshrined in its founding charter, means that the NHS must manage its resources carefully to provide care to all residents of the United Kingdom, regardless of their ability to pay. This universal healthcare commitment has led to innovative approaches to resource allocation. The NHS uses a system of weighted capitation to distribute funding. This means that more money is allocated to areas with greater need, taking into account factors such as age, deprivation, and health status. Cost management is another critical aspect of the NHS's operations. The NHS has implemented several strategies to control costs. One such strategy is the use of National Institute for Health and Care Excellence, or NICE, which provides evidence-based recommendations on the cost-effectiveness of treatments and procedures. This helps the NHS to make informed decisions about which treatments to fund. Another cost management strategy is the emphasis on preventive care. By focusing on prevention and early intervention, the NHS aims to reduce the need for more expensive treatments later on. The NHS has also embraced digital technology to streamline its operations and reduce costs. Digital platforms are used for booking appointments, accessing health records, and even consulting with healthcare professionals. Despite its challenges, the NHS has demonstrated resilience and adaptability in managing a national healthcare system. Its commitment to universal healthcare, innovative approaches to resource allocation, and strategies for cost management have all contributed to its success. The NHS's experience offers valuable insights into managing a national healthcare system. How is technology reshaping healthcare management? This question is more pertinent today than ever before. As we delve into this topic, let's remember that technology is not just about shiny new gadgets and complex algorithms. It's about enhancing human capability, making our lives easier, and most importantly, improving patient care. Let's start with electronic health records, or EHRs. EHRs have revolutionized the way we document, store, and share patient information. Gone are the days when a patient's medical history was stored in dusty files and folders. Today, thanks to EHRs, a patient's entire health history is just a click away. This not only saves time for healthcare providers, but also ensures that patients receive the most appropriate care based on their medical history. Then there's telemedicine, a term that has gained significant traction in the past few years. It's a simple concept with profound implications. Telemedicine allows patients to consult with healthcare providers from the comfort of their homes, eliminating the need for time-consuming and often stressful hospital visits. This is especially beneficial for patients living in remote or underserved areas who otherwise might not have access to quality healthcare. Another transformative technology is artificial intelligence, or AI. AI is being used to predict disease outbreaks, develop personalized treatment plans, and even assist in complex surgeries. It's like having a super intelligent assistant who never sleeps and is always ready to help. And let's not forget about wearable technology. Devices like smartwatches and fitness trackers are helping individuals monitor their health in real time. This not only encourages proactive health management, but also provides valuable data that can be used to improve patient care. In conclusion, technology is revolutionizing healthcare management in ways we could only imagine a few years ago. From EHRs to telemedicine, AI to wearables, technology is making healthcare more efficient, accessible, and patient-centric. Technology is not just a tool, it's a game changer in healthcare management. How has telemedicine revolutionized healthcare management in rural India? In a country of over 1 billion people, where nearly 70% of the population resides in rural areas, access to healthcare has always been a challenge. The vast geographical expanse, coupled with a lack of infrastructure and a shortage of trained medical professionals, has created disparities that often leave rural communities underserved. Enter telemedicine. This innovative application of technology has been a game changer, providing a lifeline to those in remote areas. It's more than just a doctor's appointment over the internet. It's a tool that's breaking down barriers and making healthcare more accessible and effective. Telemedicine utilizes digital platforms to connect patients in rural areas with medical professionals in urban centers. This allows for real-time consultation, diagnosis, and treatment advice, without the need for the patient to travel long distances. It's like having a doctor's office right in your living room. But it's not just about convenience. Telemedicine is also about quality. It provides rural patients with access to a wide range of specialists, ensuring they receive the right care at the right time. This is particularly important for managing chronic diseases, where regular monitoring and timely intervention can make a world of difference. Moreover, telemedicine is enabling preventive care in rural India. By using digital health records and predictive analytics, healthcare providers can identify risk factors and intervene early, preventing the onset of diseases. This proactive approach to healthcare is not only improving the quality of life for rural populations, but also reducing the overall burden on the health system. Telemedicine also plays a crucial role in health education. Through webinars and online resources, it's empowering rural communities with knowledge about health and wellness, ultimately fostering a culture of prevention rather than cure. In the face of challenges, India has leveraged technology to make healthcare more equitable. It's a testament to the power of innovation and the potential of digital health to transform lives. Telemedicine in rural India is an inspiring example of technology's transformative power. What does the future hold for healthcare management? Imagine an era where medical treatment is no longer a one-size-fits-all affair. Instead, it's tailored to your unique genetic makeup and lifestyle, a concept we call personalized medicine. Picture a world where your doctor isn't just relying on his or her knowledge, but also on the power of artificial intelligence to diagnose and treat you. This is the future of healthcare management, and it's closer than you might think. Personalized medicine is an emerging trend that's creating waves in healthcare management. By studying an individual's genetic makeup, lifestyle, and environment, healthcare professionals can prescribe treatments that are uniquely suited to each patient. This approach not only increases the effectiveness of treatment, but also reduces the risk of adverse reactions. Now let's shift our focus to the role of artificial intelligence, or AI. AI-driven diagnostics are revolutionizing the way healthcare professionals diagnose diseases. Algorithms can analyze a patient's symptoms and medical history, cross-reference them with thousands of medical records, and provide a diagnosis in a fraction of the time it would take a human doctor. Moreover, AI can help manage healthcare resources more efficiently. It can predict patient flow, manage staff schedules, and even anticipate medical supply needs. This level of efficiency can lead to significant cost savings and improved patient care, but the future isn't without its challenges. As we move towards a more personalized and AI-driven approach, issues on data privacy and security arise. How do we ensure that our personal health data remains confidential? How do we protect ourselves from potential AI errors? These are questions that healthcare management will need to address. In addition, as the world becomes more digitally connected, the need for healthcare professionals to be tech-savvy becomes more critical. This means that future healthcare managers will need to be as comfortable with technology as they are with medical terminology. The future of healthcare management promises exciting possibilities and challenges. It's a journey of continuous learning and adaptation, but one that holds the potential to redefine healthcare delivery as we know it. What have we learned about healthcare management? We've delved into a complex world where paradoxes exist. Decisions can mean life or death, and the stakes are incredibly high. This is the landscape of healthcare management. At its core, this field is built on pillars that hold the system together. We've unpacked these foundational elements: efficient resource allocation, quality patient care, and data-driven decision-making. We saw how these pillars come to life in the real world through examples like the Mayo Clinic and the National Health Service. These institutions have shown us that effective healthcare management can lead to improved patient outcomes, reduced healthcare costs, and a more equitable distribution of resources. As we journeyed further, we discovered the transformative power of technology in healthcare management. The digital revolution has given us tools to streamline processes, improve patient care, and even extend the reach of medical services to the most remote corners of the world. Our exploration of telemedicine in rural India showed us a glimpse of this potential. By bridging geographical distances, technology has made healthcare more accessible than ever before. And then, we ventured into the future. We imagined a world where artificial intelligence aids diagnosis, where personalized medicine becomes the norm, and where virtual reality can simulate surgical procedures. The future of healthcare management is exciting, but it's also filled with challenges. As technology advances, so do the complexities of managing healthcare systems. But remember, amidst all these advancements and complexities, the heart of healthcare management remains the same. It's about ensuring that every individual, irrespective of their location or socioeconomic status, gets the best possible care. It's about making tough decisions, balancing competing priorities, and always striving to do what's best for the patients. As we navigate the future of healthcare, effective management will be more crucial than ever before. The lessons we've learned today are not just academic musings, they are tools that can help us shape a better, healthier future for everyone.